Hello everybody, welcome to Beginner's e-Corner channel. I know you are all excited to know the lecture series on which we are going to discuss today. That is, it's based on the vital signs, which is the fifth vital sign. So you are all excited what may be the fifth vital sign, right? Yes students, the fifth vital sign is pain assessment using pain scales. So you may be astonished and you may be having doubt or fear how to assess a pain when a patient is conscious and when a patient is unconscious. So in this series we'll be seeing one by one how it can be assessed for a pediatric, how it can be assessed for an adult, in case of unconscious patient how it should be assessed. So in this slide you are now evident on what assessment is done. So this is a pain scale assessment for a children who is around 0 to 2 years of age, which we call it as FLAG scale. So the FLAG pain assessment scale, F stands for face, L stands for legs, A stands for activity, C stands for cry, and C stands for consolability. So here, when the baby is having no expression or no smile, then the baby gets a score of 0. If the baby is said to have any grimacing or frowning faces or might be showing less interest or totally withdrawn from eye to eye contact, then the baby will be getting a score of 1 under face. And if the patient, that is the baby, is able to have frequent frowning, clenching of total jaw, quivering the chin, which shows that the baby is having very high pain, that is the baby is going to get a score of 2. And in legs, when you assess, if the baby's legs are normally positioned or relaxed, then the baby is not having any sort of pain. So hence the pain scale for legs, the baby will be receiving around 0. Uneasy, restless and tension, like the baby is so much having restlessness, not having good eye to eye contact with the mother, then the baby is said to have pain. So hence here the scoring will be given 1. And if there is heavy kicking of activity or legs are totally withdrawn or you call it as total flexion, then baby will be receiving a score of 2. In activity, when the baby is said to have to be in a very quiet position, lying down normally, able to move easily, then the baby will get a score of 0, where it denotes that the baby is not having any sort of pain. In case of a mild or to moderate pain in activity, there will be shifting back and forth, squimmering and tension of the baby's activity. So in that instance, we are going to give a score of 1. And if the baby is said to be having any rigid or jerky movement or the baby's body is said to be hunched, then we'll be giving a score of 2. And upon cry, if there is no crying during awake or during asleep, then we give a score of 0. It shows that there is no pain. And if the child is going to have always whimpering activity, then that is said to be mild to moderate pain, where we give a score of 1. And the last but not the least, consolability. In that the baby will be having content in relaxed position, then we are going to give a score of 0. And in case the baby is said to have occasional touching and hugging is totally reassured or able to have consolidation, so then the baby will get a score of 1. Even after consoling or comforting the baby, there is still more difficulty, which shows that the baby will get a score of 2. So upon the 5 basic elements, we will be giving scoring rates from 0 to 2, where the most possible rated will be getting a score of 10. The next pain scale assessment for pediatrics, what we use is that from 2 to 18 years of age group is Wong-Baker's pain rating scale. In this, you can see it is a facial expression scale. When the baby is not having any pain and there is good smiling activity, we can give a score of 0. In case if the baby is said to have smiled or mild grimacing, where there is little bit being hurting in and around the site where the injury has occurred, then we can give a score of 2. If still the baby is feeling more hurt or even more hurts, then the baby will be getting a score of 4 to 6. If it is hurting a lot, then the baby may be whimpering or crying, then they will get or receive a case of a score of 8 to 10. Next, in case of an adult conscious patient, we are going to commonly use the numerical pain rating scale where the scale starts from 0 to 10. So here 0 denotes there is no pain for the patient, whereas 1 to 3 it indicates that the patient is having a mild sort of pain, and from 4 to 6 we can give that the patient is having moderate level of pain, and in case of very severe the patient will be showing or exhibiting the pain scale rating from 7 to 10. This is the last but not the least scale, which is being used for all the unconscious patients who are ventilated, or in case the patient is being intubated or under any sort of drug effects. So in this you are having the further division, which we call it as BPS scale, behavioral pain scale. So in this, in case of an intubated patients, you have a scoring rate of 1 to 4, and again in case of a non-intubated patients also you give a scoring rate of 1 to 4, which is being cross-sectioned against three major elements. One is the facial expression, second is the movement of the upper limb, and third is compliance with the ventilation. With this, we are able to give a total score, the highest possible score in case of an intubated patient. So 4 3s are 12, it will be rated against 12, and as well as for a non-intubated patient, it will be rated against 12. So that's all for today. I hope you all understood of how to assess a pain for a patient who is having consciousness or for a patient who is said to be unconscious. So if you have any doubts or suggestions, please comment on the comment box. Don't forget to subscribe and don't forget to like my channel. Thank you all.